Right now on Up with KREM, the COVID crisis in North Idaho turns critical.
I think that the thing that's really changed for us has been seeing that younger patients are dying.
What it means for patients as crisis standards of care activates at several North Idaho hospitals.
A high number of patients and low resources, what that means for your next visits to the hospital.
Washington hospitals are seeing an increase in COVID patients needing ventilators. This morning, we take a closer look at how the most recent COVID cases compare to those in Idaho.
Trouble for Gonzaga's head basketball coach, the incident that could put his career in jeopardy.
High fire danger today across the inland northwest as we see gusty wind and warm temperatures. I'm breaking down today's fire weather and talking about a concerning trend that's been around for a couple years now.
Up with KREM begins now with Tim Pham, Channing Curtis, and Jeremy Legoo.
The COVID crisis in North Idaho has taken a critical turn for our local hospitals. Thanks for joining us on Up with KREM. I'm Channing Curtis. The Idaho State Department of Health just activated what's called crisis care standards for hospitals in North Idaho. We're following these developments very closely, so this morning we have Up with KREM team coverage. Tim Pham is in the studio and he'll be breaking down what an activated crisis means for hospitals in our region. We also have a closer look at current COVID cases as well as hospitalizations in the Spokane and Coeur d'Alene areas. And Nicole Hernandez is live from Kootenai Health, and health leaders there are desperate for more help due to a surge in serious COVID cases. So Nicole, let's start things off with you. Good morning.
Yeah, good morning, Channing. So Kootenai Health says they are already spread way too thin with the amount of COVID-19 people that are in their patients that are in their hospital at this point. They say if they get even more patients, that they really won't be able to give the same level of care that they should be giving to their patients. So take a look here. This is an idea of what it's like in the hospitals right now. Kootenai Health has converted conference and classroom space into bed space. They set up 22 additional beds in their health resources center. 7 of them are already being used, plus the delayed elective surgeries. Kootenai Health Chief of Staff says the one way out of the situation is with vaccines.
You know, I don't like mandates just like any other person in this area, but I do think that people need to make better decisions. And that if they want to make a personal choice, there is a right personal choice and there's a wrong personal choice. And right now, doing nothing is the wrong choice.
Now, another area being affected by the current situation at Kootenai Health is transfer patients. Normally, the hospital only has to decline 15 transfer requests over the course of about 3 months, but these past 3 months, they've had to deny 300 patient transfer requests. Right now, the hospital is caring for 113 COVID-19 patients. 39 of those are in the ICU, and 19 of them were on ventilators as of yesterday. So last week, to try to help, Governor Brad Little did ask for 150 National Guard troops to be reactivated and sent to this area to help out with the hospital that is overwhelmed. And they are also asking retired and inactive nurses to come help out as well. Live in Coeur d'Alene, I'm Nicole Hernandez.
So over the last few weeks, we've heard the term crisis care used a lot, but what does that actually mean? Crisis standards of care is a last resort for many hospitals. It means the number of patients outnumber the available healthcare staff and resources. So this is currently the case for Kootenai Health and many other northern Idaho hospitals. The hospitals are overwhelmed with unvaccinated COVID-19 patients, which will now affect someone seeking emergency care. Hospitals in crisis care will use non-patient care areas to treat patients. These could be office spaces or even classrooms, anything that isn't normally a patient care space. Hospital staff may be unable to adequately care for the large number of patients. Supplies might be lacking, with the possibility of redirecting life-sustaining resources. Someone near death from illness may only receive comfort care, as hospital staff will use limited medicine and life-saving equipment on patients with a high chance of recovery. Idaho health officials are warning these extreme measures could be put in place statewide if the situation does not get better. More than 95% of COVID-19 patients in Idaho are unvaccinated. Well, here in Washington, hospitals are seeing a 34% a weekly increase in COVID-19 patients needing ventilators. As of Tuesday morning, 251 are on ventilators. Healthcare officials say the Idaho hospital crisis will affect Washington hospitals as well. So we want to turn things over to Channing Curtis. Channing, what are we talking about nationwide?
Ongoing COVID cases spiking, testing sites are also seeing an influx of people. Public health officials say testing, along with getting vaccinated, is crucial to ending this pandemic. Dr. Alex Grinninger is with UW Medicine and says he spends his days in the lab evaluating samples that come in from testing sites. He says the ongoing concern is the Delta variant.
Delta is basically the virus everywhere. It's like, almost basically 99% of the viruses here in Western Washington and Washington State. And it's like that across most of the United States and across the world, honestly.
Dr. Grinninger says if you have a cough, fever, or if you can't taste or smell, you should go get a COVID test. Now, our coverage on the hospital crisis in North Idaho will continue in our next half hour. But for the very latest information, you can text the word COVID to 509-448-2000. We'll send you a link with all of that information right to your phone. All right, time to take a look at what's happening with the weather. The time is now 6:04. Jeremy Legoo is in the Outdoor Weather Center. Jeremy, how's it feeling out there right now? The sun is about to come up. It was a nice kind of a crisp morning this morning when I woke up, but I understand things are about to heat up a little bit.
Yeah, it's going to be another hot afternoon, but right now it's kind of got a weird kind of eerie feeling outside. And if you look around, you can see that wildfire smoke hanging low. It's kind of got an almost pinkish, orangish glow before the sun comes up this morning. It's a weird one out here, to say the least. You can see that smoky haze there in Coeur d'Alene. It's supposed to be a mountain right about there. It's just not showing up because of that smoky haze in the atmosphere, as temperatures stay somewhat cool. 62 in Spokane, 56 in Coeur d'Alene, 46 in Sandpoint, and 59 in Moses Lake. Wenatchee, you're already up to 71. You've got some winds coming up and over the Cascades and down, and that compression is actually warming you guys up. For us here, it's air quality sitting at moderate. It's likely going to trend between moderate and unhealthy for sensitive groups today. Moderate then tomorrow as well, as wind kind of picks up across the region. We're going to watch that happen quickly. By about 11 a.m., we'll see those winds gust pretty strong, and they'll stay strong into this evening. Wind gusts up near 15 to 20 miles per hour in Spokane, up near 30 as you make your way out of town, and that's all thanks to that. The storm that moves up and over the Cascades, that's going to make its way across the state. A bulk of that moisture just kind of falls out of this thing before it reaches us, but we're going to wind up watching it sweep the region. A little bit of cloud cover, and by this afternoon, the clouds are gone. And the sun is back. Temperatures on the rise, though. As Channing mentioned, going to be a warm one. Later on this afternoon, we're in the upper 80s here in Spokane. Going to be another hot one, but there is a cool down in the forecast. I've got that coming up for you in just a bit.
Let's get to our big stories we're tracking at this hour. Gonzaga's head men's basketball coach Mark Few was cited for a DUI in Coeur d'Alene this week.
Now, Coach Few was called in by a driver who spotted him driving erratically and speeding. He was stopped around 9 p.m. on Labor Day in Dalton Gardens. Now, according to the police report, he did not complete a field sobriety test, but did blow at a .12 blood alcohol level. Now, to put that into perspective, the legal limit is .08.
New overnight, Mark issued his first statement saying, quote, "I believe as a leader and role model, I'm expected to set only the best example. The decisions I made yesterday do not exemplify this standard, and for that, I sincerely apologize to you all." He also added, in particular, "I am sorry for the hurt that I have caused to those most important to me, my family, my players, and my program." A DUI in Idaho can mean up to 6 months in jail, a fine of up to $1,000, and a license suspension of up to 180 days.
So let's talk about what this could mean for the team. So if there is a suspension of longer than 3 games, it could be a pretty big deal as the Zags are taking on Texas in the Kennel for their 3rd game of the season. And that game is expected to be one of the biggest in Kennel history. Now, right now, we don't know who would take over as the number 2. As of today, the next time we're slated to talk to Coach Few is in a month at Craziness in the Kennel on October 9th.
Students are continuing to head back to the classroom this week for their first day of school, and we want to see your pictures. Send them to us, your first day of school pictures, on social media by using the hashtag #UpWithKrem on social media, or text us at 509-448-2000, and we'll be taking a look at them all morning long.